Starting tomorrow, more Idahoans in the state's largest health district will be eligible for the vaccine. Central District Health, which oversees Ada, Boise Valley, and Elmore County, is moving up subgroup 2.3. Our Katya Stepovic joins us live with why the district is ahead of schedule in their vaccine rollout and if other health districts plan to follow. Katya.
Struggles that people age 65 and older went through just to find and schedule an appointment to get vaccinated. But now that's not the case. Now there's enough supply, but there's just not enough demand.
We are doing this because we're hearing from our enrolled vaccine providers that they have open appointments they haven't been able to fill.
Alina Gilmore is a public information technician with Central District Health. She says about 50 to 60% of people age 65 and older under CDH's jurisdiction got vaccinated. The goal was for that number to be higher.
We saw a lot of interest right when we opened up to those in 2.2 in the 65 and older group. We are now not seeing that. There's a demand from those in those subgroups that we haven't quite reached to get the vaccine in their arms, and we'd like to do that sooner rather than later.
On Tuesday, the state moved the frontline workers group up a few weeks to March 15th, but Central District Health didn't want to wait that long, and they aren't alone in their decision. Panhandle opened up to the new group on March 3rd. Idaho North Health District started taking appointments on March 4th, and Eastern Idaho plans next week. Southeastern, Southwest, and South Central will stick with the state's recommendation to start on March 15th.
I think we're further ahead than we thought we'd be at this point.
And that's partially because supply is increasing, but also,
especially in Idaho, we don't always have as much uptake rate as we'd like in regards to the vaccine. And in regards to the COVID vaccine, we may still be seeing that.
There are roughly 134,000 Idahoans in subgroup 2.3. Gilmore estimates that a little over 40,000 people fall under CDH's jurisdiction. The list includes National Guard members, mail carriers, agriculture workers, among many others. Gilmore says regardless of the reason so many districts are now moving on to the next subgroup, it ultimately means more vaccine to more Idahoans, which has always been the goal.
It feels like we're making steps in the right direction. People in the community are getting the protection they need to finally be able to see their loved ones, to connect with family, to leave the house, to get back to that sense of normalcy that we've lost.
People that fall under Central District's health jurisdiction in this subgroup 2.3 can start scheduling appointments to get vaccinated tomorrow. And a reminder to those people in groups 1 and 2, they are still eligible and can get vaccinated at any point. Shira.
Thanks, Katya. Good advice there.